I feel for people, I feel for our country now in Africa because our infrastructure is not very good.
Mm.
As burn surgeons, we are actually still very few who can help. And the victims are many. We have the guys with post rehabilitation with drugs. They form good support groups. I would want to see if my band friends, I've tried to really reach out to them, if they can also form support groups. It comes out nicely. We can come in as friends to help, but it really depends on them to come out as support group. It really helps. And Boom is not the only person who has suicidal mission. I've got very young people, 13-year-olds, 14-year-old burn victims who think this life has nothing for me. I need to end up. These support groups will really help. I feel for people, I feel for our country now in Africa because our infrastructure is not very good. As burn surgeons, we are actually still very few who can help. And the victims are many. I feel for our situation, but we can only get better. I'm trying to get, not to teach only surgeons, but the general doctor how to manage burns so that we become more in this community who can actually manage burns. But at the end of it, we cannot be in the shoes of these people who have the burns. We need to help them from outside. I think I need to pause from here and get maybe a feedback or anything I can respond to, or just listen the way I've just enjoyed listening to the sessions.
Okay, thanks, Dr. Shaban. That was very informative. I'd like to ask you about cost of treating burn victims, and maybe you can throw in the issue of NHIF. Then we'll go to the state of healthcare service delivery. In that, is there an impediment in your work? And how would you like that impediment to be improved? Are there hurdles you faced that maybe you'd like the government should do more? Because I know I've ever interacted with nurses and doctors, and many a times you might blame them, but if they don't have the equipment or the medicines, provided, they might not do a good job. So you can touch on the cost of treatment, whether it's high or low, and why, for both sides, and then touch on NHIF and the state of healthcare service delivery in terms of burns treatment. Is it good? If not, what is wrong and what can be done about it?
And now, the cost of treating burns is very, very, very expensive. When I was a medical student, I worked at Mission Hospital just to get experience. Then there's this patient who came with severe burns, and there's a white man who was in charge of the hospital, and they just said, let's transfer this person. And I knew the person was a surgeon who could do this, just in dressing itself and all that. Is a week, we are estimating that you're going to use a minimum of 16,000 Kenyan shillings. 16,000 Kenyan shillings, is it $160? Around there, if you're just doing this. The basic thing we do for a burn, that is the skin grafting. The skin grafting, the cheapest that can cost is 80,000 Kenya shillings. That is $800. Okay, and some people who have severe burns, they will need more than one session. They'll need 4 sessions, 5 sessions of this, and you can compare it with the income of them of more people. Now, I'm giving these figures because these are the figures that are quoted by NHIF, and we quote them as the cheapest it can get. Contracture release, people who have contractures release, or people who have scar revision, there actually is 120,000 Kenyan shilling. That is how much? That is around $120, isn't it? Isn't it? $1,200.
Yeah.
Okay, around $1,200 just for contractual release or scar revision or that. That is a cost. Generally, I would say that more than 90% of Kenyans cannot afford this. It has been a bit easier with NHIF, especially at the government setup. We were able to do that, and they are fully taken care of by NHIF. So the minimum they are a banned person, let's say with skin grafting, will stay with me 7 days. And that one brings the bill of the hospital. Will bring the body. If he had paid 80,000, we'll add 20,000 more. That gives it 100,000. That's $1,000 for that week for that job. As you can see, still out of reach to most of the people around. That's the cost of. I have to say, NHIF in two ways. NHIF has really done a good job, I want to say, because I treated bands pre-NHIF and I'm treating them post-NHIF. What I'm seeing is more people are actually benefiting from it. It's only that most people are not paid up members.
Okay.
If you don't pay up members, you don't actually benefit from the NHIF. Actually, I don't advocate for them. I always fight for them anyway. I'm not advocating, but if they can pay for it, it's something that is recognized, and more people are going to benefit from the NHIF coverage. They can make it better because they will actually limit you to 2 major surgeries per year, and you can see burns victim can have up to 7 surgeries, 8 surgeries.
Okay.
So if they can make it open, you can, as long as it is this burn that has occurred, you can get treated as many times as possible within the year. That will really improve this.
In a nutshell, take us through the problems of that you experience and what suggestions to overcome them, the problems that bedevil us in this sector in terms of healthcare service.
Can you hear me? Yeah. Now the problem is, I can bring it in a nutshell. Yes. I have a ward now. Yeah. I have 16 patients awaiting grafting. Why are they awaiting grafting? Because I'm a single person who is doing it, number one. Number two, I don't have theater space. I have 1 theater space a week to do burns. Okay? So two ways of doing it. If I get enough, thirdly, the equipment I'm using, actually, I bought it myself. I came with it from outside the country. The government did not provide it for me. So I'm using my equipment. I don't have enough space theater, and I'm alone. How can we improve that? Get the equipment for us. If we get the equipment, we can teach the other people to get any book. Most of the burns can be done by the general surgeon or the general doctor. So if we teach, we get that, and we get people to help us get the equipment, the government to provide the equipment, we can move on. Okay. Secondly, avail space. Avail space for us. If I had 3 days of operating in a week for burns patient, I will do a lot. If one day I can do 4, imagine a week, if I had 3 theaters, I can do up to 10, 12, which will reduce the burden.
Yes.
Fourthly, dressing materials are very expensive. Dressing materials mean now for the person who doesn't have money, we are using the cheapest available, which may not be the best. And still the cheapest available, most of the times are not available. So if they can make sure at least a constant supply of the cheapest material like the Vaseline gauze will help a lot. And lastly, manpower. To dress a burn, a severe burn, I need 2 nurses and engage them for 40 minutes. The government cannot afford 2 nurses engaged for 40 minutes in 1 patient, because my ward has 40 patients who need the nursing care. So if you can get enough personnel to do that, I'll be able to mitigate that. Those are the challenges we face, and actually I continue facing until we're trying to reach out in many forums, like in our Burn Society Forum, in the Plastic Society Forum, in the Surgical Society Forum, to try and see how can we help these victims. Yeah. Closing statement, burn is a journey. It's not a one-off treatment like malaria. It's a journey. And the best thing, if you can prevent it, the better. But once it has occurred, we need to be able to work with the clients through the many years of treatment. It doesn't stop once. It may take 10 years, maybe take 20. A patient who was 36 years old, following her up, and she was also burnt when she was 1 year old. So you need to be able to follow this journey for all that time. Okay. But otherwise, there's hope at the end of the channel. There's the surgical training we call Secosexa, which is going around. We are trying to teach as many doctors as possible the skills to do skin grafting. And hopefully we'll be able to get as many as possible being able to do that. I think I can't say more. I'm just happy that I was involved in this forum. I've really learned a lot. Okay. And it will enrich my knowledge when I'm treating victims of burns. Thank you very much.
Thank you for your participation.